I think AA and Al-Anon is a great life raft. I always give them that credit when I'm doing individual therapy is if you come in here and you have a problem in your relationship, particularly your marriage, and you feel great when you leave, I have done you a disservice. I should give you direction and insight and support and all of that. But if you're feeling as if everything is resolved when you have left my office, I have taken away that opportunity for you and your partner to actually engage. And I think that is one of the biggest issues with AA, NA, Al-Anon, all of these other groups, is that you go and get all of the resolution within it. And it creates this barrier between partners that they can't really argue about.
Hi, Travis. Thank you so much for agreeing to talk to me about your book and your work and your experience in the world of addiction and family recovery. So if you can just introduce yourself, tell people a little bit about your life, your history, what brings you here, and what drew you to write the book that we'll be talking about to those left behind, and anything else you think is important information.
Well, yeah, my name's Travis Thompson. I'm a therapist, a mental health therapist in Murfreesboro, Tennessee. It's just south of Nashville. I've worked in facilities, both specifically with drug and alcohol abuse and also severe mental health facilities. I've started programs related to that, specifically around families and long-term recovery. I now am in private practice and I'm hoping to finish my PhD next year in marriage and family therapy with a focus on addiction and relapse and recovery. And so most of my practice is around addiction and recovery for couples, or even if I just see somebody individual, how they exist in their family system.
It's not always the case, but often the case that people that end up in these positions have some sort of connection to the content that they're studying, teaching, working with. Do you have much personal connection to this kind of stuff? And if so, what is that?
Sure. Yeah. For me, it was early on, I would say like 15, 16 years old. I was, the term that I use is a sprinter. So it didn't like build up over 10 years.